So today our topic is about Staphylococcus, and in Staphylococcus we will discuss these six things, and in any bacteria we will discuss these six things, and our whole discussion will revolve around these six things only. Okay, the first one will be introduction. How is the bacteria and what are its features? The second will be in what culture the bacteria grows, and third will be virulent factors. Fourth will be clinical manifestations, and fifth will be investigation of choice, and the sixth will be drug of choice. So, or you can say treatment. So, as we know, the gram-positive bacteria may be cocci or bacilli. We differentiate cocci on the basis of catalase test. So, what is catalase? Catalase is an enzyme that converts hydrogen peroxide to water and oxygen, and there will be the formation of bubbles. So, if we can say we took any sample or and mix it with the catalase, there will be bubble production catalase positive, and there will be no bubble production catalase negative. It may be slide or it may be any test tube. Okay, and coagulase. So there is also coagulase test. So as we discuss about the streptococcus, let's go into the first topic, that is introduction. So staphylococcus may be coagulase test positive or coagulase test negative. So what is coagulase test? Coagulase converts fibrinogen to fibrin, and there will be clotting. So as you can see, in coagulase positive, if there is a clotting and the liquid can't flow, and the coagulase negative, the liquid flows. The coagulase positive is only Staphylococcus aureus, and the rest, that means Staphylococcus epidermis and Staphylococcus saprophyticus, is coagulase test negative. This one, coagulase test negative. And in this coagulase test negative, we differentiate the two on the basis of novobiotin sensitivity. Novobiotin sensitivity. Okay. The sensitive, novobiotic sensitive, and the other is novobiotic resistant. The sensitive one is Staphylococcus epidermidis, and the resistant one is Staphylococcus saprophyticus. So introduction is, I guess, over. Now let's turn into the culture media. So the Staphylococcus, we first discuss about the Staphylococcus. It loves the salt. So the culture media in which these bacteria grow best are milk salt media, mannitol salt agar, and rudolphus media. And it's worth mentioning that Staphylococcus aureus, the term aureus means gold, so it produces golden yellow colonies. Now let's come into the third category that we are going to discuss, that is virulent factors. There are 7 or 8 virulent factors. Let's discuss about them. The first virulent factors that makes these bacteria more virulent and troublesome for humans, the first one is enzymes. So enzyme may be DNase, hyaluronidase. So DNase, it breaks the DNA, lysis of DNA as the name suggests, and hyaluronidase, you can see it as a drill. It helps the bacteria to drill. Okay, so there is phosphatase, staphyloronidase, and worth mentioning, the one that I missed is, of course, coagulase. And you should note that coagulase that I'm going to discuss about is only in aureus, Staphylococcus aureus. It's absent in epidermidis and saprophyticus. So the first one, enzymes, is over. Now coming to second one, it is exotoxins. And the thing about these exotoxins are these are super antigens. So what is a super antigen? Super antigen is an antigen that directly bind to the TCR, T cell receptors. Okay, so three major exotoxins are there worth discussing. The first one is exfoliate toxin. Now, what does the exfoliate toxin do? It causes a thing known as staphylococcal scalded skin syndrome. So, what is this scalded skin syndrome? It may be severe or it may be mild. In severe form, there are toxic epidermonecrolysis. Toxic epidermonecrolysis, and this occurs in adults, and in children we call it as Ritter's disease. Okay, and in scalded skin syndrome, the skin is peeled and the underlying red area is exposed. We do it with confirm it with Nikolsky sign. So what is Nikolsky sign? Nikolsky sign means when you rub the skin, the top layers of skin are eroded. Okay, so severe is done. Now let's come into the mild. There are Bull's impetigo and Remphigus neonatorum. So our first toxin is complete. Now the second one toxin is toxic shock syndrome toxin. So it's of little value that I tell you it causes toxic shock syndrome. And in toxic shock syndrome there is vomiting, there is fever, there is hypotension, and also DIC, and the characteristic sunburn rash. And this toxic shock syndrome is usually associated with tampon use in females, of course. Tampon use in menstruating females. So it occurs mostly, but it may be found in men and also non-menstruating women also. But most common thing is this tampon, and this occurs. The toxic shock syndrome is a characteristic feature that we associate it with generally with tampon. Okay, and the third toxin is enterotoxin. Entero means intestine, and as the name suggests, it causes food poisoning. So the thing that you need to know about this enterotoxin, that is heat stable. It's heat stable, and incubation period is less. So you can see it's 1 to 6 hours. In 1 to 6 hours, you can see the symptoms. The vomiting is the main feature. Predominant feature is vomiting, and also diarrhea may be seen. And this enterotoxin is usually as the toxic shock syndrome. Toxic is usually associated with use of tampons. The enterotoxin is with food, but usually salads that are not washed or cleaned properly. And these three are the toxins. Now we come to the toxins are complete. So first one was enzyme, second one was toxins, and third one is cytolysins. Cyto means cell, lysins mean breaking down. It may be beta hemolysin. It causes hemolysis, and the worth mentioning is that it follows hot cold phenomena. What does that hot cold phenomena mean? Hot means it causes hemolysis at 37 centigrade, but this hemolysis is visible only at 4 degree. That means in cool it's visible. Okay. Also, the other toxin is PVL. It's called Pantone Valentine leukocytin. It causes decreased leukocytes, WBCs. The fourth factor, or you can say the fourth virulent factor, is protein A. It's very important. So in protein A, first I'm going to give a briefing about the immunoglobulin. So this is an immunoglobulin, heavy chain and light chain. So this is an immunoglobulin. So normally when the bacteria enters, it binds at this site. This is known as FAP site, and there is opsonization and phagocytosis, and this bacteria gets killed. But the protein A in the Staphylococcus aureus, it helps the bacteria to bind in this region, that is FC portion. So bacteria survives. So protein A facilitates the Staphylococcus bacteria to bind at FC portion, thus helps to escape the antibodies. So our major chunk is over. We have discussed the three introduction, we have discussed the cultural characters, we have discussed, and virulent factors we have discussed. Now clinical manifestation, investigation, and drug of choice are easy. So let's dive into the clinical manifestations, and you can remember these clinical manifestations by a simple mnemonic, and this mnemonic is that Staphylococcus aureus cause soft pains. So S for scalded skin syndrome, O for osteomyelitis, and F for food poisoning, and T for toxic shock syndrome, P for pneumonia, A for arthritis, I for infective endocarditis, N for necrosing fasciitis, and S for surgical site infection. The investigation of choice is the culture media by culture, or you can do also PCR. The IOC is over. And the sixth one is treatment. So at first, penicillin was used. Penicillin was used, but the plasmid, and in more particular, our plasmid and beta lactamases cause resistant. So we give that person methicillin. But these clever bacteria made MEC gene, MECA gene, and cause methicillin resistant Staphylococcus aureus. So we gave vancomycin. But these clever bacteria made Van A gene and caused also the vancomycin resistant. So it resulted in VRSA, that means vancomycin resistant Staphylococcus aureus, and now we are left with linezolid, daptomycin, streptogramin, and mupirocin. And in the treatment, it's worth mentioning that in toxic shock syndrome, the treatment is clindamycin. And these antibiotics are contraindicated in food poisoning because the person is vomiting, the antibiotic will not work, and food poisoning is caused due to the toxin, not the bacteria. So antibiotic is of no use. It was all about Staphylococcus aureus, and there was a little bit different in Staphylococcus epidermis and saprophyticus. And we all know this Cogle is negative, but in epidermidis, it's very short topic. Epidermidis, it's part of normal flora in skin, particularly nose. Okay. So epidermis is the most common cause of prostatic valve infective endocarditis. Most commonly in less than 12 months after the surgery. It causes prostatic valve infective endocarditis. And how it causes this endocarditis by producing biofilms. As you all know, biofilms. What are biofilms? It is a film of glycocalyx and a sticky substance that adheres to the valves and cause endocarditis. That's all you need to know. And saprophyticus, the introduction is also same, and the thing that you need to know about saprophyticus, it causes the UTI in younger female which are sexually active, and it also causes, we can say, it's honeymoon cystitis, and it's not sexually transmitted. So that's all you need to know about the Staphylococcus.